Okay, so we are now live on YouTube. Good morning, everyone, and thanks for joining us. It's Friday, June 26th. Today, we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, with an update, as well as you'll notice that Mike's not with us today, so she's going to do a little enforcement update as well. And then we'll also hear from Chair Karen Redman. So we'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Good morning. So I first wanted to provide some information regarding Forest Heights. So you will notice that 4 additional staff cases have been added to the number of staff cases for the Forest Heights outbreak. These were picked up as part of the most recent round of testing at Forest Heights. As part of very close monitoring of the outbreak situation with frequent tests. They were all asymptomatic cases. A careful assessment of each case is conducted. Staff were wearing appropriate PPE, and the risk to residents and other staff is considered low. Asymptomatic cases being picked up during staff testing is likely something we will continue to see and see more of, as long-term care and retirement homes now are undertaking regular testing of their staff. So we will continue to carefully monitor for Forest Heights. Regarding what I just said about asymptomatic staff cases, based on more regular testing of staff in these homes, picking up sporadic asymptomatic cases, an outbreak will no longer automatically be declared when such cases are detected. An investigation and thorough risk assessment will be done first. Some of these positive test results may also, in some cases, be signs of infections that may have occurred in the past. So, although upon detection of these cases, measures for outbreak and enhanced monitoring will still be put in place, they may be scaled back appropriately if the investigation and further monitoring does not suggest evidence of an ongoing risk. I was grateful for the opportunity to connect with members of the business community yesterday. I wanted to make sure that businesses knew that even though we may not have all of the answers, we want to work with them to understand their needs. I appreciated hearing about their experiences, both their successes and challenges in implementing the public health measures. We will continue to work with them to identify how we can support them. I also want to thank our testing partners. I appreciate all their efforts as testing has significantly increased over the last month. Our testing partners are working tirelessly each day to meet the needs of our community. The testing sites, as you may have heard, are very busy. Increased demand often means longer wait times, especially at the new drive-through site. So I would like to ask everyone who is going to a testing site to please be prepared to practice your patience and your kindness. Everyone at the testing sites is doing what they can to try to provide the best service to our residents as much as possible. And I would also like to remind everyone that there are 4 assessment and testing centers across Waterloo Region, so I encourage you to explore your options if you are seeking testing. So finally, I continue to recommend comprehensive measures to slow the spread of COVID-19 in our community. As a community, we have and are continuing to do a good job. But as we have seen south of the Canadian border, we must not let up on the recommended public health measures. We've heard a lot about masks recently. While masks should be worn when physical distancing cannot be guaranteed, as a reminder, they are not a replacement for the other measures. Physical distancing, proper hand hygiene, and staying at home or self-isolating if you have any symptoms are all critical measures that we all must embrace as part of our new normal. We have a collective responsibility as a caring community to protect each other. Thank you for doing your part. Let's continue to protect each other. And now I have an enforcement update on behalf of Mike Murray. So regarding the enforcement numbers for this week, so no new charges were issued the week of June 16th to June 22nd. 200 site visits were made with either education or a warning provided. 244 visits were made where no action was required. So that just gives you a bit of an overview in terms of our numbers for this, for the past week of numbers. Thank you.
Thank you, Hsiu-Li. We'll now turn it over to Chair Redman. Go ahead, Karen.
Thanks, Julie. While we're doing a good job at keeping the spread of COVID-19 fairly stable, we're all anxious about the case numbers climbing and having to go into lockdown again. The reality is that COVID-19 remains in our community and we need to learn to live safely within it while a vaccine and treatments are developed. As restrictions ease, we are slowly realizing that things aren't back to normal and the pandemic is not over. Limited numbers in stores, waiting in line, waiting longer for service can be frustrating, but this is our new reality and the way that it's going to be for a while. Anxiety, restlessness, fear, and frustration. It's all what we're all feeling right now. It's normal to be experiencing these emotions as we do the best we can to keep our friends, our family, and our community safe. It's important to remember that all of us are experiencing these feelings, and we must be patient and kind to one another. I know when I extend kindness and understanding to others, I feel better about myself. So as we head into the weekend, we all need to acknowledge that business owners are doing their very best to reopen their businesses to serve you. I ask you to be kind to others waiting in line, be kind to our frontline workers, and be kind to our regional and municipal employees who have been working tirelessly since the pandemic began. Whether you're making a phone call, sending an email, or posting to social media, please remember that there are people working on the other end who are doing their best. In closing, I ask that we do not undo the progress that we have made so far and that the many personal sacrifices we have made over the past few months will not be in vain. Like others around the world, we are all trying to find the balance between keeping COVID-19 in check and living our lives. I'm confident that we can keep the positive momentum going and continue to be kind to each other while doing it. Thank you.
Thanks, Karen. We'll now turn it over to you guys for questions, and we'll start with Damon from Woolwich Observer. Go ahead, Damon.
Hi, good morning. My first question is for Dr. Wang. I was just looking for some clarification on the outbreak status at these long-term care and retirement home facilities and why it won't be, why everything's being scaled back. Could you explain the whole process a little clearer?
Sorry. So thanks for the question, Damon. So not everything is being scaled back. It's just that, as we are now doing regular testing, or the homes rather, I should say, are doing regular testing of their staff as per the provincial directives. We are coming, we are finding more and more sporadic asymptomatic cases. Our experience with COVID over the last 3 months has led to some updated guidance about these asymptomatic cases that don't necessarily appear to be related to one another. And so, they may not represent a situation of true risk for facilities. But it's important, especially because they're very vulnerable, and we see that COVID-19 can spread very rapidly in these settings. It's important to be very cautious. And so we are still going to put in place, close monitoring and even measures that you would put in place for outbreak, but we're not going to necessarily declare them an outbreak. But we're going to continue to follow them closely, recommend appropriate measures based on a risk assessment of the situation. In the beginning, when we saw what kind of impact COVID-19 was having on our homes, and we didn't want to take any chances, it made sense that anytime you automatically had a case, you would declare a home an outbreak. But now that we've had more experience and we know that people, for instance, who may have had an infection can continue to test positive, even though they're no longer infectious, we want to make sure that with some of these results that we may get sometimes where they're asymptomatic and they don't seem to be related to each other or to the home, that we don't automatically put a home in outbreak because one of its staff has tested positive as part of the regular screening that's now occurring in these homes if they were asymptomatic.
Okay, and then my next question, with moving the motion forward for mandatory masks to council, it's either July 6th or 7th. What type of outcome do you see coming from that meeting? And what guidance are you suggesting for them to make in the decision?
I might refer that question to Chair Redman, as it was a council decision.
Thank you, Dr. Wang. Yes, I would have to say that I think Dr. Wang has been very consistent with her messaging. This was a decision that was made by regional council. There was a range of views that were expressed both at council, and I believe that during the interface that Dr. Wang had the virtual meeting with the business community, there too is a range of views. So the council asked staff to come back, and I don't know that, and they sent out a doodle poll, Damon, so they may have landed on a date, but it looked like the 6th, 7th, or 8th were the possible dates. And staff will come back with a draft bylaw, and the devil will really be in the detail. We have asked for a municipal bylaw that says that mask wearing is mandatory, and we've also asked staff to look at the code of conduct for all public transit, and to change that to say that wearing masks is mandatory, again, because on public transit, as it fills up and more people use it, there's probably less likelihood that people will be able to do the requisite social distancing. So that draft bylaw will come back to that special council meeting, and it will be debated. Two of the things I feel really strongly about is that there has to be an education component as well as awareness, so that the public realize that this change is happening and can prepare themselves for this new mandatory protocol. It's certainly been part of the guidance of public health that Dr. Wang has continued to promote for weeks and weeks now, but it will, we hope, impress upon the public that this is not a nice thing to do. It's an important thing and a necessary thing to do.
Okay, and I know this is a bit of speculation, but is there a concern with people pretending that they have medical needs and just not wanting to wear the masks when this is passed forward? And how will enforcement be placed? Because I know Dr. Wong's been kind of against the idea of having the onus on the store owners.
So again, the devil's in the detail, and Politics 101 says you don't answer speculative questions. So all I can say is I really anticipate looking forward, but Dr. Wang, Mike Murray, and we have had active conversation and have been monitoring the experience of Wellington, Dufferin, Guelph to see what their experience has been. Our preferred method will always be to work with businesses and not put them at a disadvantage, recognizing that nobody wants those businesses to open more successfully than the actual owners. It's been a long, dry spell, and they are adhering to a lot of the protocols. So I'll be interested to see what our draft bylaw looks like.
Okay, and then just one last question. The Face Mask Friday social media campaign, has it been successful?
Dr. Wang can have that one.
Sure. Julie, might you have, I think I have some stats, but I'd have to pull them up. I don't know if you might have them.
I'm sure my colleague is sending them to me as we speak, but it has been, very successful. I know that I saw something last week about 50 photos being submitted as part of engagement, but our engagement numbers were out of the park compared to our normal. Do you have it there, Hsiu-Li?
Yeah, I got it now.
Awesome.
Thanks. Yeah, so we were very pleased with the response that we saw last Friday and the support that our community showed for face masks. Our first two posts last week had significant reach. They were seen almost 40,000 times. Yeah, so that's the number I had. Thank you. And yeah, we're going to continue to promote all the public health measures, including the wearing of face masks when people cannot socially distance, because we want more and more people to adopt these measures, and we want to normalize mask wearing in our community.
Okay, that's all. Thank you.
Thanks, Damon. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, good morning.
Hi, good morning.
You know, this week marks a change in your tone or tune when it comes to mask wearing, because before it was, you weren't going to, it's not that you weren't going to consider it, but you were hoping on compliance. What was it specifically that has made you, Dr. Wang, and I guess you, Chair Redman, to change this and consider making mask wearing mandatory?
So I'll take the lead, and if Dr. Wang wants to jump in, she can, Nicole. The reality is this is not a public health order by our acting officer of medical health. This is a municipal bylaw. So this is not something that public health is directing. This is something that we as regional counselors are considering to recommend to our public right across the region. We have actively monitored mask wearing. We've actively monitored the experience in Guelph. And we feel that the time has come where our public, who have up until this point been very compliant and very much a partner in how we've followed the public health guidance and the advice of experts from Queen's Park, that is one of the reasons why we went into phase 1 recovery and then into phase 2 as quickly as we did. Having said that, it is a statement. We are asking members of the public to participate. To Damon's question about whether or not people will say that they have a medical condition, I don't think you can legislate a sense of consciousness and investing in the community. And I think it's really telling to look at over the 2,000 visits that enforcement has done in the community, and how it really is probably a couple dozen notices and tickets that have been made, is that people will comply and that they do respond to education and compliance. So I think as we go into phase 2 and look at going into phase 3, we recognize COVID-19 is in the community. There is and will continue to be community spread, and the wearing of masks, especially on public transit, is a way to keep your germs to yourself and protect other people. So it was at this juncture, having monitored everything else and having had active conversations and considerations, that regional council felt that this is something the municipality could do. I don't know, Dr. Wang, if you want to add to that.
That sounds really good. I would perhaps just add that, you know, we get a lot of comments, you know, different views. And sometimes we get some comments that at times I just like to provide some clarification on. And so it's not necessarily that the views have had but more so I'm trying to provide some clarification. For example, in response to the comments that, you know, I had gotten about the fact that I would never issue an order. So I was trying to provide clarification to the businesses that I am not issuing an order, and my position about that has not changed at present. but that there is always the possibility that in the future, there's some order that is issued with respect to COVID, just to answer the question, or rather to provide clarification on the perception that there would never, the medical officer would never issue an order with related to COVID-19. So it was just that. But as I think the main points are really what Chair Redman has stated. Yeah, I would just leave it at that.
Okay, if you can just then clarify for me, because did you say if a bylaw was not passed, you would consider issuing a public order?
Yeah, no, that's correct. That was a response to comments that if a bylaw were not passed, I would never issue an order. So, it was to respond that I'm not saying I would never issue an order. Like anything related to health and what's needed in the community, I need to assess that. And so it's always an option that is available. But yeah, maybe it was one of those situations where trying to provide some clarification to a hypothetical led to potentially, other perceptions. So it really is that it's not saying that that's what I'm going to do. It was a response to comments I had received that would never happen. And what I was trying to say is that, the approach that the region is taking is to ask staff to bring back a proposed bylaw. And that's the approach that we're going down. And, I continue to strongly recommend that people wear masks when they cannot physically distance.
And Nicole, if I can just jump back in, there was a variety of views at regional council that were discussed, and there's certainly a variety of views of the people who are reaching out to me. And Dr. Wang heard that on the call with businesses. One of the things that was talked about at regional council was that the community liked clarity, and this municipal bylaw will provide clarity. And that was one of the rationales why some members of council felt strongly that us providing that mandatory aspect of mask wearing just provided a little bit more certainty towards the education of the community. Because Dr. Wang, while she's clarified it, I think people like certainty.
A big confusion in regards to the case count. There's 3 new cases being reported today in the region, but there's 4 in staff at Forest Heights. Can you just help clarify that?
Yeah, no, thanks for the question, Nicole. That's a good one. Sometimes what happens is, we have a new case, so we put it up in the overall numbers, but then it takes a day or two to get the case details to be able to correctly attribute the case to, say, Forest Heights or another setting. And so sometimes there can be just some additional clarifications made to the data. And so that's why it can be slightly different because, for example, a case could have already been counted in our overall case count, but then the next day be attributed to Forest Heights and show up in their case count. So it's not that there's a number missing, it's just that the attribution to a home sometimes happens, a day or two later.
And one last question. Looking elsewhere at Kingston, it was considered to be one of the areas that had done really well in terms of handling COVID-19. But then this week, a nail salon, 10 cases popped up in relation to that among staff and clients. Because of this, our Waterloo Region inspectors on high alert and inspecting nail salons much more critically?
Oh, we've been on alert, and we've been doing our normal inspection activities and following up on cases that may occur in workers since the beginning, and especially since the reopening. So we haven't changed. We've always been watching this and monitoring this and investigating this very closely. That's definitely an area of risk when you open up businesses, that there could be spread in a business setting. So we declare one when we have evidence that there has been spread in the business setting, and then if there is a need for the disclosure due to an increased risk to the public, we will do that. Most of them to date have not been that type of outbreak. They've been outbreaks that have not put other people at increased risk, other people in the general public, that is. But just to keep the public informed about the fact that there are these workplace outbreaks, we will put them in aggregate on our dashboard. So it's definitely an area that we continue to closely monitor, because there's always that risk that can always happen. And we can expect that every once in a while there's going to be settings where a worker or maybe a patron or whatever, there are people that may test positive. And in some of these cases, there may be others that have been at risk and that need to be tested, and then we could find other cases. So you can have these sort of blips in numbers. So you have to kind of look at the overall progression and see how is it going overall. But I think what it shows is that, again, this is a virus that can quickly resurge if we do not continue to carefully adhere to the public health recommendations. And when we see signs that there is an outbreak, we need to do everything we can to try to reduce the spread in those situations going forward.
Okay, thank you. That's it.
Thank you, Nicole. We'll move over to Tim from 570. Go ahead, Tim.
Hello, good morning. My first question is Prime Minister Trudeau has said provinces have failed to support seniors as there's many outbreaks and cases in long-term care facilities. And he continued to say federal government is ready to move in to bring up national standards. Has public health heard, or the region heard of anything from the federal government about this? And what are national standards?
So no, we wouldn't communicate with the federal government directly. It would be the provinces, the provincial government, that would be in contact with the federal government. And so, yeah, I wouldn't have any more information about that.
And I guess just from a political perspective, Tim, both the previous provincial government and this provincial government have turned their attention to some of the gaps in service and the need to have a standardized set of requirements in long-term care. So this is an issue that's long been coming to a head. I think the pandemic has really highlighted the gaps of service. So I know the provincial government is occupying itself with talking to the federal government. So that's a conversation that would happen between those two levels of government. But as you know, Waterloo Region, like many municipalities, does have the responsibility of operating long-term care at Sunnyside Home. We're very proud of our standards and working conditions for the staff and how people who are residents there are looked after. But there is absolutely attention being given to that by the senior levels of government.
And today in Kitchener, splash pads are open, but they're going to have reduced hours and limited time use at 15 minutes. Will there be excessive cleaning of these splash pads when they're closed? And is the region worried that people won't follow these guidelines, especially when Canada Day is approaching?
So I would actually refer you to the municipalities that are operating these. So we've been working with them and letting them know the list of public health requirements that they would need to follow to operate these splash pads, and they're the ones that would best be able to answer how they're operationalizing this. But it's been really good to be able to work with them on this so that they can open safely.
And I guess I feel like I'm channeling Mike Murray here. All area municipalities do have bylaw enforcement officers who would probably be on site to make sure that those regulations and guidelines that they've established at the area municipality are enforced.
Okay, and then the KW Oktoberfest is 105 days away. The event is still thought to be on in terms of planning. What is your advice or thoughts on our local festival still moving ahead this year when the one in Germany was canceled?
So from a political perspective, I think I would just say to the public to stay tuned. That is a decision that will be made by Oktoberfest Inc. in the Festhallen. And I've been in contact with them, and I don't know if Dr. Wang has, but that is a decision that they will have to make. And I don't know if we will be into phase 3. I don't know what phase 3 will look like. The province hasn't announced it. So that's a decision that is theirs to make.
Yeah, I think we'll have to see closer to the time what the recommendations would be. You know, as Chair Redman said, we're still in phase 2 at the moment.
That's great. Thank you so much.
Thanks, Tim. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. First, a question for Dr. Wang. Will you have input on the draft bylaw as staff work on that, or will they be consulting you?
Yes, they will be. They have started.
Okay. Are there
to meet the timelines that council set?
Right. Are there like sort of a top 3 things that you want to see in the bylaw?
You know, I just know that the regional staff are working very hard on you know, trying to put in place a bylaw that follows the direction of council in a way that balances the different aspects that they need to balance whenever there is a mandatory bylaw. And, you know, this is something that's still in progress. So I would say when it's drafted and it's available, you know, then we'll see what it contains. But yeah, for example, you know, I would want to see that there be exemptions for people who are not able to wear medical masks, and you know, that the bylaw have an enforcement approach, and that is a very progressive approach. You know, that starts with education and awareness raising, with the goal of trying to help our citizens comply, because as I understood, as I also believe, like Chair Redman, most people want to comply, and you know, so I think the approach that our region has taken in regards to enforcement since the beginning of this pandemic has been a very good one, because it's always tried to take that progressive enforcement approach, with first starting to try to educate people and help them comply. You know, those would be a couple of the key considerations that I would hope would be in a bylaw.
And can you just give me your sort of general thoughts then? Because as we talked about, you didn't want to issue an order, at least not now. And then council first was just going to look at transit, and then that was brought into a mandatory one. So just what are your thoughts on that, since, as you said, the approach to now has been to encourage people to do the right thing and educate them?
Yeah. I have been in favor of policies that promote the widespread use of public health measures. You know, some businesses have put in place policies for that, for masking in their business establishments, and you know, they've been successful at that. And that's an example of, policy that I've been supportive of. And so I feel that this is absolutely in regional councils' right to look at this type of region-wide policy or requirement based on what they think is in the best interest of our region. And I think that, my views and my recommendations are actually complementary to that, because I have continued to recommend that people, practice these measures, but I have not been in favor of the use of the Section 22 tool as a means to achieve that at this point in time. And especially issuing such an order that would, be directed towards businesses without having the opportunity to first consult with them. So I have not been in favor of the use of that tool, and I currently still am not in favor of the use of that tool. But I've always been in favor of well-considered policies that can promote the widespread use, the widespread adoption of the recommended public health measures.
Okay.
Yeah.
And then another question, probably for both of you. Guelph has seen an increase in cases since they made the mandatory mask order. So is that something that concerns you, that the same thing will happen here when we're doing so well at keeping numbers low?
Yeah, no, that's a good question, Joanna. So any number of factors could be behind this. Like I said, sometimes they're just, for example, someone had a party and then 20 of their friends got infected because they were, they're not socially distancing or things like that. So it's one of those things, like I mentioned, where any number of things could result in temporary increases in the numbers of cases. And we see that with our epi curve, right? Sometimes we have small numbers, sometimes we have larger numbers. So I think we're going to continue to have to live with that. And the important thing is that we try, whenever we start to see something happening, we try to clamp down on that as much as possible. And the way that we'll be successful to clamp down on that is if the vast majority of people continue to follow the public health measures. If they do, they will give us the greatest opportunity as a community to keep the levels of infection low. So that's why I keep really trying to encourage people to not let up, because we won't be able to let up until we have an effective vaccine or treatments because of the nature of this virus. And so we have to really just continue to pay attention. And when we see cases, if we see situations where there's a potential for spread because there are outbreaks, we need to address that as quickly as we can. And we need the help of our community to just overall keep transmission as low as possible, decrease spread as much as possible.
So Joanna, if I can just pick up on Dr. Wang's comments, I would tell you two things we know. We know that we have increased testing, and with increased testing will come increased evidence of cases. We absolutely know that there is community transmission of COVID-19, and we know this will continue. So I don't think it's cause and effect, and as much as they're sort of happening at the same time, I don't know that the correlation is there when we know that the increased testing and the spread of COVID-19, as Dr. Wang says, will continue to happen until we have a vaccine or a cure for it. So all of this is predictable, and council is coming down on the side of public education, public awareness, and continuing to take the guidance of public health, one of which points is wearing masks when you can't physically distance, but it's also good hand hygiene, it's staying home when you're ill. All of those things need to be embraced by our community as we go through phase 2 and hopefully into phase 3 soon.
Okay, thank you. Those were my questions.
Thanks, Joanna. We'll move on to Paula from CBC. Go ahead, Paula.
Hi. So first of all, with the new guidelines around when you declare an outbreak, is there any chance that you might be declaring any of the current outbreaks as resolved anytime soon for similar reasons?
Yeah, we look at that every day. We look at the situation. With some of these homes, we're still waiting for test results. So, you know, we don't necessarily have a full picture yet. But for sure, that's always something that's on our minds, because we don't want to keep homes under outbreak longer than they need to be. But, you know, we do have to wait for test results, and there have been a lot of tests that have gone into the province. And so we don't necessarily immediately get those results back. So we have to wait for them, and the prudent thing in the meantime is to continue to put in place the appropriate measures until we know that it's safe to remove them.
And then my next question, I know that you touched on this a little bit at the outset of the meeting, but what has your reaction been to seeing some of the situations in the US, like in Texas, in Florida, in recent days?
Yeah, it's very concerning when you see that, and it just reinforces for me that you know, this can spread again quite rapidly. I think Ontario has done well, and they're continuing to do well, but we continue to be in a fragile state, all of us, in the country practically. You know, for sure, in Waterloo region, I would say that it continues to be a fragile state where the number of cases can quickly rise again. If we're not careful and we start to become too lax with following public health measures. But, you know, our community has done well to date. And I just, you know, I know that our community is one that is known for caring for its neighbors. And so I'm just gonna, you know, continue to encourage that we do that. And I know a lot of people want to continue to do the right thing.
Thank you.
Yeah.
Thank you, Paula. We'll move on to Irene from Air News. Go ahead, Irene.
Hello, my question is for Dr. Wang. About the municipal breakdown on the region's COVID-19 website, there
Yes.
have been thank you. There have been 8 cases listed for North Dumfries for weeks. What is the status of those cases?
I wouldn't know actually the individual status of the cases, but what we've seen with COVID is that the large majority of people will recover, you know, within 14 days and be considered resolved. For some, it takes longer than that, but the large majority, you know, will resolve. If they haven't developed complications and passed away, for example. But yeah, so I wouldn't know about those 8 specific. But, broken down, we probably would never break it down to that level, because then you could identify people.
Okay, so it could well be that those cases are resolved?
Yes, those are only cumulative cases.
Oh, it's cumulative. Okay, that's great. Thank you.
Yes.
That's all.
Okay, so with Irene, that brings us to the first round concluding. Does anyone have any other questions? Show of hands. Oh, Nicole, go ahead.
Should we be concerned the asymptomatic cases that popped up at Forest Heights, is that indicative of the general population, that there are a number of people walking around that may be asymptomatic as well?
No, I think there likely are a number of people that, you know, may have evidence if you tested them of having the virus. That doesn't necessarily mean that they're infectious, right? With asymptomatics, it's not possible to tell necessarily. What we do often see, though, is if you test somebody who is asymptomatic and they are infectious, you do tend to see that 2 or 3 days later, they will start to develop symptoms. So the test was kind of a bit of a precursor to their development of symptoms. But there are others for whom, you test and then they have no symptoms and you test again and they're negative. And so that may imply that they're actually not infectious, or they possibly had exposure to this earlier and they still, have some virus when picked up by the test. So it's not possible to know. But what we do know, Nicole, is that when you look at the body of evidence, we do know that those that are most likely to pass the infection are those that are symptomatic. Although that doesn't mean that you can't pass it when you're asymptomatic. We think that happens as well, but it's more likely to pass it if you are symptomatic. And importantly, people that are most risk for getting the infection are those that are in close, direct, prolonged contact with somebody who has the infection, right? So that's what we see when we investigate cases. We see that's the primary risk: close, prolonged, direct contact with another case. And so that's why there's all those public health measures that we're recommending. Physical distancing, not being around others when you're sick. So just casually passing by somebody that may have it is likely not a risk. If you're physically distant from somebody, you shouldn't be at risk either. And so, it's not necessarily reflective of an increased risk in the general population, but what it is telling us is that, now that we have testing that has been broadly expanded to include anyone who would like to have a test, we are going to see more and more of these, and we are starting to see more and more of these sporadic cases of people that test positive, do not have symptoms. And so we'll just have to continue to monitor overall the evidence about these, but based on what we've seen to date, it's, we need to be cautious and treat them as potentially infectious, but in a long-term care situation, when they're not necessarily related to each other or to the facility, we also have to make sure that we don't overdo it, and put in more precautions than would be appropriate. Sorry.
Okay. Thanks, Hsiu-Li. It looks like Damon has a question as well. Go ahead, Damon.
Hi, so for Dr. Wang, this is a follow-up to Joanna's question. You mentioned Section 22 being used as a tool. Could you explain that and what Section 22 is?
Okay. Yeah. So medical officers of health, this is for all medical officers of health and associate medical officers of health. We have, responsibilities under the Health Protection and Promotion Act. We also have powers under that act. And one of the powers is the ability to issue what is known as a Section 22 order when it comes to communicable or infectious diseases. So that order is powerful and allows us to order individuals to do or not do certain things when we feel that the risk is high and that this type of order is necessary. And usually they are issued when you have that high legal threshold where you have you have a high risk and you feel that it is necessary to go to an order. Oftentimes, it is something that it only follows when you can't get voluntary compliance or compliance in a less coercive way, because you have to show that your use of a powerful tool is a proportionate use and a judicious use of the tool. So I'll try not to keep going. I can do that, especially when I'm a little bit tired at the end of the week. So that's what a Section 22 is. So I would say bottom line is it is a powerful tool. Yes, it can be used, but it needs to be used judiciously and when it is felt to be necessary.
Great, thank you for the clarification.
Yeah.
Okay, and I see Paula has a question. Go ahead, Paula.
Hi, so I had a question. I understand that the province has some new guidance out around migrant workers that will allow asymptomatic workers who have tested positive to keep working as long as they follow certain public health measures to minimize risk. Does that make sense or seem appropriate to you?
Yeah, so it's all based on a risk assessment. Those are the provincial guidelines, so I probably wouldn't be the best to answer them in any detail. But basically, as I mentioned, you have to take a look at the environment in which these asymptomatic people are in and are working in. So if it's a migrant farmer, a migrant worker on a farm who's working by himself, who's well because they have no symptoms and they're not in contact with other people, then it's not a situation that puts other people at risk, right? So those are the types of situations the government was considering when they decided that some of them can go back to work. It kind of ties into what I said earlier, is that as we're doing lots of testing of people that don't have symptoms, we're going to find every once in a while people that test positive and that are not necessarily, putting others at risk at that moment, or at least they wouldn't if they were allowed. They wouldn't if they were isolated from other people. And it's possible for certain professions, like those maybe who work from home or those that work on a farm in isolation from others, that they can continue to do their work even though they have a positive result. I don't know if that helps.
So is it fair to say then that it maybe depends a little bit on their living circumstances and their working circumstances, if it makes sense or not?
Yeah. So what we've seen in the outbreaks among those workers, in the more southern parts of our province, have a lot to do with their living conditions and how close they are to each other. When they're in their bunkhouses. So definitely, and we've seen that also with workplaces. Industries where workers work really closely together, they're more susceptible to having outbreaks because they're more susceptible to having transmission amongst their workers that way. So yeah, I would say that the government is trying to put in place recommendations that are appropriate, proportionate to the risk.
Thank you.
Okay, thanks, Paula. Are there any other questions? Okay, I'm not seeing any hands up at this time, so we will conclude today's media briefing. Thank you all for attending. There was a lot of good conversation today. We hope that you have a good weekend. Take care.
Have a good weekend, everyone.
Thank you.